After starting this module, you shall be able to determine the determinants of price and quantity of health, its demand and supply, understand the concept of production function of health and cost of healthcare, analyze the role of government in healthcare sector. Whenever you feel ill, there arises a demand for a healthcare service. It is basically a derived demand which arises to maintain a good quality health, which is consumption good as well as an investment for an individual. The first place to approach is a druggist whenever one falls ill. If the problem is not cured, one visits the nearby doctor, and if the problem persists further, an individual will visit a specialist or a hospital in a search to cure his health issue. Even though the person is the buyer of healthcare services, his treatment is completely beyond his control and depends on the diagnosis of the doctor. In today's world, with healthcare market working with latest technology updates and quality research and discoveries of treatment which were earlier unimaginable, have given rise to increasing healthcare cost and spending. The cost and financing of healthcare services differs widely across countries, with US having one of the most costly healthcare system along with a health insurance dominating healthcare system. On the other hand, government plays an important role in Canada's healthcare sector and also in many other developing countries. People travel across the globe today in attempt to avail the best quality healthcare at reasonable prices. To understand the concept of cost and price of health services, we investigate the role of demand and supply. However, there are many factors beyond demand and supply that are important to analyze healthcare system. Next is the economic dimensions of healthcare system. Healthcare sector consists of different agents who play an important role in determining the cost and price in the healthcare market. Healthcare is a complicated topic and separate subject of study. That's why we have health economics as a subfield of economics. The system works not on the basis of single demand and supply, as we have other agents like insurer and government playing an important role in this sector. When an individual is insured, then a person need not pay for the services availed to maintain good health. Government has an important role in case of market failures and non-availability of health services to all due to high prices and to promote equity in this sector for all irrespective of the income distribution. In the chapter, we will analyze the role of demand and supply along with the impact of health insurance and the effect of government intervention on cost and price of healthcare. Next is demand for healthcare. Demand for healthcare services is derived demand for a final commodity, good health. Health enters the utility function of an individual and increases the satisfaction with good health and is therefore considered as consumption good. Demand for health, like any other commodity, has a negative relation to its price. Increased price of healthcare services will increase demand. However, in this context, health insurance plays an important role. If an individual has a health insurance, then price of healthcare services will not bother his demand for healthcare, as he actually do not have to pay anything other than the insurance premium to avail these health services. Some co-payment charges are to be paid. Therefore, with insurance, demand is expected to rise, though the marginal social cost is higher than marginal private cost in the case of person with health insurance. Secondly, demand for health services are often inelastic, because when a person is ill, no matter what is the change, is price. An individual always tries to meet his healthcare needs first, even by compromising on the demand for other goods and services. There are also informational problems attached with healthcare services. A typical buyer of health services cannot determine the quality of what is being purchased. One has to believe the health examiner that he is acting in your best interest. The demand of services are not determined by the purchaser but by his examiner, and the whole treatment is based on the trust on the doctor with the belief that he will work in your best interest. Hence, with health as a commodity, we noticed three characteristics as health demand is negatively related to its price, inelastic nature of demand for health services, and informational problems. Health as investment. Money spent on healthcare today produces returns in future and is therefore also considered as investment. Age, diet and self-care determine the probability of becoming ill and of dying. Mortality increases with age. Other factors affecting mortality are diet, exercise, risky behaviors like drinking, smoking. If an individual dies at an early age, his family actually incurs huge economic losses which are implicitly measured as income that he could generate in future if he was alive. Therefore, it is important to invest in health today to reap future returns. Secondly, health affects productivity of a person. A healthy person will always produce more and will have lower loss of working days due to illness as compared to a sick, unhealthy individual. Since factor payments are made according to individual's productive capacity, a healthy one will always generate higher returns as compared to an unhealthy individual. Next is the determinants of demand for healthcare. Price of healthcare services. As any other normal commodity, the demand for healthcare is negatively related to its own price. Demand for healthcare is expected to increase with fall in its price and vice versa. Next is presence of health insurance. In presence of health insurance, demand for healthcare increases as the private cost of the health services fall. There are other problems like adverse selection and moral hazards associated with health insurance, which leads to excess utilization of healthcare services in case a person is insured, because he may get careless about his health due to availability of insurance and no monetary burden in case he falls sick. Next is number of buyers. The demand for healthcare increases with rise in population. Each composition of the population also affects the demand for healthcare. An economy that consists of older population will have high demand for healthcare. Similarly, with increase in the population with high risk activities like smoking, drinking, etc., the demand will increase. Income. Increase in income, especially per capita income, has a positive impact on demand for healthcare. Healthcare is a normal good and therefore has a positive income effect. Availability and prices of substitutes. Other medical treatments like Ayurveda, homeopathy has an impact on demand for medical services. Their prices can change and influence the demand for medical services. For example, a knee pain or muscular pain can be treated by a chiropractor at a lesser cost than an orthopedic doctor, which results in a shift of demand away from the medical services. Next is taste and preferences. A shift in people's attitude towards maintaining a healthy lifestyle brings change in the demand of healthcare. With medical advancement and belief in the society that today there exists a treatment for all ailments has produced an upward shift in healthcare demand. Next is supply of healthcare. A production function of a good is defined as a relationship between output produced and inputs used like labor, capital, etc. The production function of a hospital consists of the labor, doctors, surgeons, nurses, technicians, ward staff, administration and many more. Its capital stocks include building, medical equipments and intermediate inputs. Raw materials includes dressing kits, medicines and other pharmaceutical products. Supply is controlled in various forms to ensure quality health care. Doctors faces barriers to entry in form of licensing that limits competition and increase efficiency. Doctors not just think about profits but also bears the moral responsibility as reflected by the Hippocratic oath to work in best interest of the patient. There is wide variety of occupation in health sector with considerable variation in salaries and wages. Majority of healthcare workers are employed with few big hospitals. However, the healthcare industry consists of large number of doctors, offices, clinics, hospitals, private and government being just a small part of the industry. Technological advancement has paved a huge increase in supply of medical services and introduction of new lines of treatment which were totally unthinkable in the past and has contributed to increased supply of healthcare services. Next is determinants of supply of healthcare. First, number of sellers. It includes hospitals, clinics, nursing homes, HMOs, drug companies and all other suppliers of medical services. All the suppliers are regulated to ensure quality services by their respective medical federations. Barriers to entry through restrictions and delay in introduction of new technology due to quality testing restrict the supply of healthcare services. Second, resource prices. An increase in the cost of input underlying the supply of health facility increases its price and produces a leftward shift in the supply curve showing lower supply at each given price. The cost associated with improved and new technology along with salaries, wages and drugs and pharmaceutical prices influences the supply price. Third, technological advancement. New techniques of treatments with advanced surgeries and operation using upgraded technology has produced a positive impact on the supply side of the healthcare industry, but at the same time has led to increases cost associated with these innovations in the healthcare sector. Next is the price determination in healthcare sector. Health supply and demand analysis to an extent help us to explain the difference in prices of healthcare services. Price could be higher due to high demand or limited supply as shown in figure 1 and 2. This gives the simplest explanation of why healthcare is so costly in US and relatively affordable in Europe. However, this simple analysis does not seem to be very convincing, which leads us to wonder to locate other factors that determine the cost and price of healthcare. Imperfect knowledge on demand side in form of lack of knowledge about the true valuation of the treatment and thus the actual price probably because of insurance cover does not lead to the demand analysis work very well. Similarly, on supply side, few health providers have large market power which must be considered while locating price differences across countries with some hospitals running by private ownership and other by the state. Those are mainly non-profit hospitals. At times, prices are not determined by demand and supply but are fixed by the government on normative grounds. At times, prices are also set on the basis of bargaining strength of hospitals and drug suppliers. With inelastic demand along with lack of information and some market power with suppliers of healthcare services, its prices could tend to be very high and the actual analysis would be a lot more complicated. In a competitive market, demand and supply interacts to determine the price. In the field of healthcare markets, These tools provide limited insight since you cannot judge or compare the price of a treatment by simply looking at the catalogue of treatment of number of ailments of different hospitals. Many of the prices are determined by the interaction of few big players like government, insurance companies and healthcare providers. Healthcare providers like hospitals and doctors get paid by the insurance companies, government and hospitals who finally determine the healthcare services demand. Insurance companies play a very vital role in price determination of healthcare sector. Insurer reimburses the hospital for the cost of the care of the person insured, which mostly are set by a pre-existing agreement and thereby influences the price and the demand in this sector. Next is health insurance and demand for healthcare. Health insurance leads to lower private cost of healthcare to the person insured. Insurance can be purchased privately by individuals or is paid by the employer and comes as a component of employees' CTC to the company. Group insurance is another form of insurance. Community-based insurance by government and other non-profit organization also provides health cover to individuals and family. Along with health insurance, there comes other problems of adverse selection. Imperfect information to the insurer land up everyone with high risk in the insurance pool, and moral hazards, carefree attitudes and actions towards own health which raises the probability of availing healthcare. These problems are present when insurance is provided by private insurers or government. The demand for healthcare reflects the marginal cost of the service to the insured to the extent of co-payment he has to make to avail the healthcare facility. The demand for healthcare services increases with insurance cover, but at the same time a high co-payment restricts the demand for healthcare services. Next is the role of government in healthcare sector. The basic need for government intervention in a healthcare market is mainly to address the problems of market failure. Market fails whenever demand and supply forces fail to reach equilibrium. In regard to healthcare sector, there are several reasons for government to intervene. Externalities. Externalities refer to a situation where the economic activity of one individual affects the economic activities of others. If an individual is suffering from flu and the cold, then the probabilities of others to fall sick increases. Individuals' decision does not reflect this social cost as they typically think only about themselves and not the people around. Therefore, there is a need for government to intervene to provide basic hygiene to all and affordable price in the interest of the society as a whole. Next, commitment and quality. Government plays a vital role in ensuring the quality of drugs as well as services of doctors in the healthcare market. Individuals who are also the buyers of health services cannot evaluate the quality of a doctor or the medicines prescribed. Therefore, it intervenes through licensing examination for doctors before they are allowed to practice and testing of drugs to ensure the safety and effectiveness of the treatment. At the same time, it is necessary to provide commitment for treatment of certain ailments and emergencies. Next is patents and market power. High market power in hands of few healthcare providers and hospitals along with patented pharmaceutical products provided by few giant players and small numbers of insurance providers do not produce efficient market outcomes and raises the need for government intervention. Next is equity and fairness. Efficient markets outcome do not guarantee equity. However, access to quality healthcare should be available to all the citizens of a country irrespective of their income distribution or the fact whether they possess health insurance or not. It is necessary for overall growth and development of the economy because health is also considered as investment. The next question is that if government intervention is important in healthcare markets, then how does government intervene? The government basically intervenes through subsidies and taxation policies. It subsidizes costly healthcare treatments to make it accessible to common man. It contributes towards the insurance premium of employees along with the employer. Healthcare is subsidized through tax benefits. Secondly, government regulates the market through imposing barriers to entry, obtaining license to practice, timely quality checks, controlling the price of life-saving drugs, etc. It also intervenes through provision of insurance and information. People are informed through televisions, radio, statutory warnings related to healthy lifestyles, like smoking is injurious to health. It also covers poor and children under various health insurance schemes and plays a dual role of insurer and health provider. In this lesson, we have analyzed the economic dimensions of the healthcare sector. We found that how a simple demand and supply analysis, though a useful tool, cannot alone explain the process of equilibrium outcome in the healthcare market. We studied various determinants of demand for healthcare like number of buyers, income, taste and preferences, prices of substitutes, etc. And also the determinants of supply like cost of resources, number of sellers, etc. We also highlighted the role of health insurance as an important dimension for healthcare sector. It influences the demand for healthcare in a positive way but is negatively related to co-payments. Demand for healthcare is basically derived demand for health, which is both consumption good that increases the utility of the individual and an investment that increases the productivity and future returns. It is important to study the role of government in healthcare as it plays a vital and active role through quality checks and other restrictions along with facilitating equity and fairness by providing a common access to healthcare services by all the individuals. It helps to solve the problem of market failure that arises due to adverse selection and moral hazards and also target externalities. It can be concluded that a single demand and supply analysis of healthcare sector, though a useful tool, is not sufficient to explain all economic dimensions of healthcare sector. The insurance providers, households, government and health providers, hospitals, whether state or private, are big players of healthcare sector and are equally important in determining the equilibrium outcome of the healthcare market.